Hi, good afternoon. This is your Rockland County Executive Ed Day. We're here for our weekly COVID-19 update, and we have actually, since things are going very, very well in that regard, we also bring some other items that county government is doing to the table while we have this time to spend together. Um, we're now in our first full week of phase four, the final phase. Those, unfortunately, some of us have not been opened up yet. To those folks who are in phase nowhere, please know that we are advocating every day to get some decision making done out of Albany to give you some direction as to where we're going to go. I'd like to update you on our numbers first. We don't always do that, but occasionally you should hear some good news. The metrics we're using in New York State to determine reopening progress is very, very good here in Rockland County. Our decline in total hospitalizations average continues to drop even further. Right now, we have 7 people in the hospital, half of which I think 4 are confirmed COVID, 3 are not. At the end of the day, we may recall all not that long ago, we were sitting with over 300 people in the hospital. So it's just stark change in where we were. And we see very few new hospitalizations. Our hospital bed and our ICU bed capacity is very good and well beyond the state minimum standards. We do continue to see a handful of new cases each day, which serves as a reminder that COVID-19 is still a concern. It is not going anywhere. We cannot let our guard down. Unlike others in government, I'm not here to scare you. I'm here to make sure you understand what we're dealing with. We have, unlike the measles outbreak, where we had immunizations, MMRs, where we had natural immunity, we don't have this with this virus. What we do have is, well, on a learning curve as to what this virus can do. You all have heard all the variety of different things that have been said about this virus. I'm not going to repeat them now, but it just tells you that we're learning, and that's really what it comes down to. We have to continue to do smart things to combat this virus. But the cases that we have are well within our ability for a Department of Health to do any investigations as it relates to contact tracing when someone does get ill. And we want to track down where they have been and allow people who are there to know what's going on so they can take the proper precautions as they go forward. We've made incredible progress here in Rockland and in the Mid-Hudson region and in the state of New York, and I have very, very strong faith we'll continue in that direction. Now we do have with us my communications director, John Lyon, or as we know him as the man behind the curtain. He's been fielding a number of your questions today, and John, let's have at it.
Okay, we'll dive right into the questions. We had quite a few today. This one related to county government itself. When will the county hiring freeze be lifted?
Okay, the county we're still evaluating the fiscal impact of the pandemic on county finances and have not considered an end date to a hiring freeze. We have been we've embarked already back in March, early March, on steps to mitigate the fiscal damage caused by this pandemic. And we are getting hit very, very hard. We're identifying unspent funds that were budgeted, and we're putting that aside right now because we are getting a major hit in 2020. Reduced sales tax revenues obviously is a major issue. So we're finding different monies that are not spent and putting that where it belongs right now to protect us. As I mentioned earlier, early March, we implemented an austerity program here in March. We're continuing to submit expenditures that are related to the COVID-19 pandemic to FEMA for reimbursements. We have lobbying for federal representatives to include direct financial assistance for counties in any future federal stimulus bills. I belong to 2 major organizations, the National Association of Counties. I'm on the board of directors there, and also the New York State Association of Counties. They both are advocating strongly for direct fiscal help to the counties who provide services. You know, in its simplest way to explain what we're we're dealing with right now, we'll just look at our own homes, our own households. Picture this: you have a fairly good nest egg in the bank. Crisis hits your home, and it completely wipes out your bank account. That is what we're facing right now in county government. But worse than that, we don't know what 2021 brings. Now, back to your situation, not only in 2020 did you lose your entire savings, but you were informed by your boss on January 1st you're taking a 20% pay cut. That is very similar to what we're dealing with here right now, because we don't know how the economy is going to recover. Will it be a V shape straight up? Will it be a U shape? So we don't know what our revenues are going to look like, or, for example, your paycheck, the 20% cut of a paycheck. So we're progressing in a very determined manner in order to try to minimize the impact that we're dealing with. We don't want to get in a situation that we had many, many years ago, not that long ago, 2008, where there was massive tax increases made because of a lack of preparation, a lack of fortitude, a lack of decision making. We're making those decisions here and now in order to stave off some of the damage that this pandemic is doing to our finances.
Okay. On to the next question. We're still having a lot of concern and uncertainty about what New York State is doing.
Yeah.
Have they provided any updates on when driving schools will be able to offer 5-hour classes so kids can then schedule their road tests
Right.
and get their licenses?
I know this is frustrating. I've spoken to a number of the schools and parents and young people who are messaging us. I continue to bring this issue up during our regional control room calls with New York State and the governor's staff. We have not yet received an answer. It's frustrating. It does appear to be a fairly simple fix to this, and that's what makes us all get frustrated right now. Now, I understand that many of our local schools have been discussing the precautions that they're able to put in place to safely resume this activity. When they close schools, I don't think they're realizing this is not a school in the traditional sense. This is a training session. There is a big difference here. But frankly, my feeling is this should be a very simple matter. I would personally give you a green light if I had the authority to do that. No county executive has the authority to do that. We go to the control rooms, we do share the concerns, but at the end of the day, it stops there, and it's up to the governor's staff and the Department of Health to make the final decisions. But it would help, frankly, if you contacted the governor's office directly. I think it's important that he hear what you're going through. His office is 518-474-8390. Again, that's 518-474-8390. Please feel free to call.
Okay. Do you know when the state is going to provide scientific data proving why certain industries were removed from phase 4 and why they're not able to open?
This is exactly when some people read my commentary at times, and again, I've been very, very clear. Every time I've spoken, I give Governor Cuomo credit for taking control of the situation and planning out and charting out a plan of action. Very well done. I am not of the same mind at this juncture, because I see, when I hear the statements, follow the science, follow the data, and then we ask for that science and data and we don't get it. We get generalities. That doesn't work in my book. It is either one way or the other way. If we're going to speak in generalities, then do so. If you're going to talk about science and data, show it. Show it to us so I can convey it to you. We have not been provided with any data or any evidence to back up the continued closure of certain industries like gyms, bowling alleys, and movie theaters. It's as simple as that. We have asked these questions to the top officials in the New York State Department of Health, and again, we've received often generalized statements. That is not going to make it in my book. So I will continue to insist on information. I think, in fact, I know you deserve that. I mean, the least I can do for you is to be a pain at times to make sure that they understand in these control rooms that someone is hearing what you're talking about, and they're going to hear it from me. I will be your voice in those control rooms. But again, at the end of the day, we have to do our best to convince the governor's office that to move forward in some of these areas.
Okay. Addressing a local concern, this person writes in, a coworker just came from a store where the majority of shoppers are not wearing masks or face coverings. What do you recommend I do if I encounter a situation like this?
I would say that if you speak to a manager and the manager is not receptive to your observation, and also, by the way, stores are allowed under executive order to exclude people who are in their stores without face coverings. I would ask this question. If you went into a store and saw a dirty shelves all the time, if you saw tainted meat, bad food being served, what would you do? I know what I would do. I would not be shopping there anymore, and I would let the manager know I'm not shopping there anymore, and for the reason why. We're not going to have 100% compliance in this. There's always going to be people out there who are going to do what they wish to do. So at the end of the day, it's up to you to shop with your feet. If you believe that they are not taking care of you, if they're not taking care of your concerns, they're not concerned with their staff's concerns, maybe they should be told you're not shopping there. Maybe they should be told you're going to go back on social media and post why you're not shopping there. Maybe they should be told you're going to take all your friends the same thing. Maybe then they'll wake up. So, and also the other option to do is, after telling a manager, if it's a corporate store, write to corporate, write to the corporation who runs the chain, for example, and that would be a good thing. As I said, the governor's orders are clear. The store owner can exclude people from shopping in the store without face coverings, but ultimately we cannot control the actions of each and every person. But I want to emphasize this: when we see this person without a mask, as people are very sensitive to this, I understand that person sticks out like a sore thumb. I would kind of remind you that when you look around, you're going to see the vast majority of people simply doing the right thing, because that's what we're about. We do the right things here in Rockland County. And I'll say once again, as much as we're learning about this virus, which I mentioned early at the outset of this program, there are things that we strongly believe are working. Is it 100%? No, nothing's 100% because we have a lot to still learn about the COVID-19 virus. But we seem to understand that certain things are working. Simple practicing of good hygiene, washing your hands, 20 seconds soap and water, covering your face, maintaining a social distance from people when 6 feet away. If you can't be socially distant, wear a face covering. These habits, most believe God helped us get this under control locally. In order for our shops and our restaurants and our businesses to remain open, we must maintain that progress. If we start slipping, you've read about this, I believe California, I think, decided to close down stores,
Pretty much
bars,
everything.
They went back to phase 2. So if you think about it in that way, only outdoor dining, no more indoor dining. A lot of the things that we're doing now were taken away by the state. I can't think of a more injurious thing that could happen to us right now, once we're finally getting in the right direction, to lose that. So, what I would say is ask everyone in Rockland County to do their part to make sure that that the trend continues. And again, we're in it together, folks. We're looking out for each other here. That's what we're supposed to be doing.
Okay. Speaking to that topic, is there any timeline as to when events can operate at half capacity as restaurants do, such as a wedding, a venue, a retirement party, something of that size, both indoor and outdoor?
Okay. First, to address the indoor events at catering halls, for example. New York State says that they are working on guidance for hospitality venues. Again, they're working on it. It has not yet been released, so I don't have an answer for that. Again, we would like to see some more of a rapid approach to this, some more sense of urgency, because I understand from hearing from you that this is your livelihood we're talking about, your families. These are our local, by the way, folks, these are our local neighbors who own a lot of these locations. So as soon as we get it, we will get it off to you, and just understand that I hear you. That's why I appreciate this venue right now, because I get to hear what you're saying beyond what I hear when I'm out and about in this county. And I repeat what you're saying to try to come to some resolution to your concerns. As far as outdoor events, there's a little bit of a quirk here. Federal judge ruling at the end of June completely removed the limits on outdoor gatherings as long as social distancing is maintained and or face coverings are worn, and that distance, if the distance cannot be maintained. This is an assessment of the court decision that leveled the playing field when it came to the percentage of the space that could be used for a business and a percentage of space that could be used for a religious gathering. Court held you can't differentiate between a church and an office building, or a synagogue and an industry location. You have to treat them equally. The second part of this decision dealt with the outdoor gatherings, and our county attorney here in Rockland and the county attorney in Orange County also have been under control room calls. We made it very clear to the state that the interpretation is plain and simple from what they've read, that the court's holding was that as long as you have plenty of room and you can socially distance, there should be no numerical end to who you can have at your house, or have at an outdoor gathering, for example. If you think about it, it makes sense. If you have a backyard with 50 people, there's a certain amount of grass you're going to be walking around on. If you have a 2 acres lot of land with 50 people, there's a lot more room. So it's a logical application, I think, from the federal court. So that's where it stands now. If we hear any differently, we will let you know. But as of now, as long as you socially distance and you have face coverings when you cannot, you can have a gathering, or you can go to a gathering with people limited only by the social distance aspect of it.
Okay. We got this question in last week as well. When will the banks be opened with people being able to go in and speak to a teller and cash their checks and do that thing kind of face to face?
Right. I hope this isn't the same person who sent it in, because the banks are allowed to open. They were included in phase 2, so they have been able to open for a while. My bank, I've been inside. It was a pleasant experience for a change, instead of waiting in line at a drive-in or going through to the lobby area only. But some of these branches may have limited hours, but most of these branches should be open by now to allow for in-person services. If you're not sure, you should call your local branch and find out what precautions or changes they have put in place. This way you have some knowledge going right in. So I would suggest call first, see what their hours are. You may be just missing the cusp of a closing or an opening during your day. So I would call them first and find out exactly what's happening, because there have been a lot of changes of late.
Okay. If someone tests positive for antibodies for COVID-19, are they counted as a confirmed COVID case here in Rockland and in New York State?
No, they're not. Being tested and coming up positive for antibodies, you're not counted. Only those who are tested positive for COVID-19 are included in our positive cases.
Okay. This next person writes in, they know that the Department of Health came to an adult care facility a couple of weeks ago. Did they disclose to you their findings? And there's also a concern that the staff there are not getting the proper PPE. What should be done about that?
Okay. This must be the State Department of Health, because I know the State Department of Health has oversight and jurisdiction over these facilities. First, if staff are not getting the proper personal protection equipment, PPEs as we call it, from their employer, you should file a complaint with the New York State Department of Labor. There's no getting around that. That's what you should be doing. You have a right to be protected, and your employer should be giving you the ability to protect yourself. The findings they've had so far, which is very interesting, is some of the lowest infection rates that are found with the healthcare workers, because they are suited up. They know what they should be doing. They do it the right way. They know how to wear all this equipment. So that's one thing that's come out of this pandemic we've been dealing with. The link to the Department of Labor will be posted on the Facebook page at the end of the comments section. And while I do not know what the results of any State Department of Health investigation may be, I have been informed that New York State Senator James Skoufis from North Rockland will be co-chairing 4 hearings on New York's response to the coronavirus pandemic. There have been a lot of questions being asked for a variety of matters that had come to pass since the beginning of March. The hearings, as I understand it, will be scrutinizing the operations in nursing homes, as well as challenges our hospitals have faced over the past 4 months. Those of us we've been doing this regularly. You recall some of the concerns, some of the worries, some of these things that have been coming out that had a lot of people upset. Well, that's going to be revisited during these hearings. The hearings will include testimony from the governor's office, the nursing home management, hospital stakeholders, frontline workers, and patient family members. The hearings, all of which will be conducted remotely via Zoom, are scheduled for the following dates. Monday, August 3rd, that's the upstate nursing homes. Monday, August 10th, will be downstate nursing homes. Wednesday, August 12th, the hearings will cover hospitals. And Thursday, August, did I say Wednesday? Wednesday, let me just be clear, Wednesday, August 12th, not Thursday. Wednesday, August 12th will be hospitals, and Thursday, August 13th will be the workforce. Those asked to provide testimony will be by invitation only. However, members of the public are welcome to submit written testimony or tips to Senator Skoufis' investigative team. I'll give it to you, but John will put this up also. It's investigations, very simple, investigations at nysenate.gov, investigations at nysenate.gov.
Exactly. So if you have a tip about something that happened where you or a family member resides, send it into them and they'll look into it.
Right.
So that'll do it. That's our last question that we received today. I want to thank everyone who commented and sent it in, and I'll turn things back over to the
Okay.
county executive.
All right, well, look, the last few months have been very difficult, but we are headed in the right direction. Something we need to speak more of, because part of getting back to some sense of normalcy is to recognize and believe that we are getting there. But everything we're seeing here, and people here have expressed concerns to me. I've gotten a lot of communications from folks, messages with concerns about opening up, businesses opening up, are we safe, etc. Again, look, there are no absolutes here, none whatsoever. We understand this virus is very devious. We do take our best shots at dealing with it. Our infection rates are low. All the metrics we have put us in a very good place, but it is still a dangerous virus that's out there, and to this day, there's not 100% understanding of exactly why it targets certain people in such a strong, virulent manner. They just don't know. So best thing we can do is continue doing what we have been doing, which apparently is working quite well. So what I want to reassure you is when we bring issues forward, when we advocate with the control room, for example, to see certain things happen, we do so with concern and a judicious approach. That's what we do. I've said it before, it's safety first and people always. We will not do anything that will recklessly cause any kind of problems for our county and our community. That's just not what we're about here. So we take, and there's a lot of information that you may not see on Facebook or in press releases. There's a lot of information that we research also. We just don't accept information from anybody. What we do is we look at the science and the data. We are quite capable of doing that. I just the other day looked at a completely new study on face coverings to see what exactly should and should not be done, what the findings are. So these are things we constantly do. Our health department does this all the time. Our planning department works with the health department to make sure we have the latest metrics, so if we can spot anything unusual going on in Rockland County, we can react to it. So, again, I just want to let people understand what the driving force here is. The driving force here is to get us back to normalcy in a safe way. That is what we're looking to do. And before we adjourn today, there's a couple of items I want to mention that we're doing here in county government. Our Department of Social Services is still looking to recruit caring foster parents. They are holding a virtual informational meeting every fourth Wednesday of the month at 2 p.m. Every fourth Wednesday of the month at 2 p.m. The next one is just coming up on Wednesday, July 29th. So I would ask you, if you need more information on this and you want to register, please contact DSS at 845-364-3527, 364-3527, or email us at the address that'll be posted at the end by the comment section. This is very important, and I can think of very few things in life that are more important. Making a difference in a child's life. It really is an amazing feeling. I mean, those who have been blessed to be teachers, for example, understand this very clearly. I coached for 20 years in this community, and it was an amazing experience, 3 different sports and 20 years. All those young people have gone past me, and I like to think I've instilled some positive things within them that they took forward. Being a parent, you're the ultimate teacher, so you know how that feels. Think about a young person who has no one, who needs that right now, and think about the gift that you can give, the gift of yourself. So give that some consideration, and if you feel the fit may be for you, just give them a call. I mean, we have counselors up at Social Services, help you try to navigate through your thoughts if if you're thinking of doing something like that. So it's a good thing to do. Department of Health will be conducting a free drive-through rabies vaccination clinic this Sunday, July 19th. It's coming Sunday from 10 a.m. to 1 p.m. That will be at the Fire Training Center at 35 Fireman's Memorial Drive in Pomona. That is off exit 12 of the PIP, or right off of 45. If you're heading to the Boulder Stadium, for example, before you get to the stadium, if you're coming from Route 45, you make a right turn at the corner just before the stadium field starts. Take that almost to the end. At the end is High Tour. and making a left through the gate. That'll bring you right into the fire training center. Now, to prevent the spread of COVID-19, all attendees must limit the number of passengers and remain in the vehicle. Face masks or cloth face coverings are required for everyone in the vehicle, because this will be some close quarters issues here, giving a pet, a vaccination. So very important to maintain that social distancing and have your face covered also. Lastly, something that we haven't spoke about too often, but was a major situation here in Rockland County last year, measles. I promised everyone, once we did battle with that epidemic, that when we came out the other side, which we did, we would do everything in our power to make sure it never happened again. It happened for one major reason: we lost herd immunity in this county. And we found out quite accidentally a good part of the nation did not have that. We fought a 51-week battle against that epidemic. And at the end of the day, we were able to have the last 2 weeks measles-free. We were able to maintain the measles-free designation by the World Health Organization for this country, the United States of America. Rockland County did that. We had the longest and one of the worst epidemics in the nation, and other states looked at us to try to figure out what could we do, what could they do to deal with their epidemics that we're having. So it was a heck of a battle, but key to making sure that we do not lose the battle again is to make sure that we have the herd immunity. And a major piece of that is something we don't have for COVID-19, immunizations. You need to be immunized for a number of different things as you go to school. Our health department has been following us up, and they're seeing a slippage in immunizations. And we understand why. There's a lot of limited movement now with the COVID-19. Immunizations seem to be taking a back seat to some other issues right now, and we understand that. And we're not in crisis yet, but let's understand something. If we do not maintain that herd immunity, we could end up having another measles epidemic if someone from another country comes here, which is exactly how this started here in Rockland County. So just to remind folks that talk to your healthcare professional. For children who are not school-aged yet, get them on a regimen of an organized way of getting immunizations, childhood immunizations, to protect your child. And remember, there will be no wiggle room given except for a medical exemption from a doctor to get immunizations when you go to school. You will not be allowed to go to school. That is state law. It always has been state law, and we're ensuring that it gets enforced now. So I would urge parents, take a moment. If you're not sure, contact your local your healthcare provider. Find out when it's the right time for your child to get immunizations, because they have to be done at a certain time in their lives. We don't want to put them in a situation where they could be injured. So please take care of that. You're doing the right thing for your child. You're doing the right thing for your family. You're doing the right thing for your community by making sure that you do that. We maintain that herd immunity, because if those young people who can't get those shots, they typically have significant medical issues. They're weakened already. Their immune systems are already compromised. The last thing in the world you want to see is somebody in that situation get measles, because it'll put them in an ICU at the very least, and it may kill them. And measles is not fever and a rash. That's what we were told when we were kids. It's not. It's a lot worse than that. So they didn't find that out until much, much later. So I don't want to go on too much, but I don't like fighting battles, winning, and having to fight them a second time. It's just a complete waste of my time. It really is, and a complete waste of your time. So with that, that's pretty much it, I think, John. Any other questions came in that were hot topics? Or
that'll really cover it for the day. If you are interested in learning more about childhood immunizations, our Department of Health has a lot of information available. You can go there through our website, rocklandgov.com.
Yep, and the County Health Department has a lot of information on their website. So Rockland County, 2 years running, healthiest county in the state of New York. That's not an accident. We've been in the top 5 for the last 5 years now. We have a tremendous health department. They've done an amazing job in delivering services, not just by providing a place for you to come. They've gone out to the community. They've gone to various locations where oftentimes people are underserved, and they've done an amazing job. And that started in 2014. And little did we know how much of an advantage that come into play when the measles hit. And John has something, he's got his finger pointing in the air.
And to be clear, our health department does check every school in this county to make sure the students going there are immunized and have fulfilled those
Right.
requirements.
They're following the tenet of a great president, Ronald Reagan: trust but verify. Okay, and just so you do know, we have had cooperation of BOCES and the school districts. We went through this with them. They don't want to have a situation either, so they've assured us that they are crossing every T, dotting every I to make sure that the children are getting their appropriate immunization. So with that, we're going to close out the day. Have yourself a wonderful rest of the week. And until next time, again, this is your County Executive Ed Day signing off.